omega-3s and pregnancy and fertility. We're going to be talking today about why they are so important and what you should be looking for in your fish oil, omega-3s, DHA. We're covering all of it. Stay with us. All right, so today we are breaking down the importance of fish oil and how important it is when it comes to not just pregnancy, but also fertility, okay? So what is fish oil? Fish oil is really, really important for our bodies. It helps decrease our inflammation. It also helps to regulate our hormones, and it is considered a essential fatty acid. There's DHA, EPA, and there's actually a third one called ALA. That's why they're omega-3s, 3 of them, right? So ALA is very hard to kind of convert into a usable form. EPA and DHA really, really are the movers and shakers when it comes to fish oil. So a lot of times when you're looking at a fish oil product in general, it's going to have total triglycerides, but it's going to break it down into DHA and EPA, okay? EPA is really, really good for decreasing inflammation. You'll hear it for people that maybe have autoimmune diseases. They're trying to protect their heart, things like that. It's very beneficial. DHA, you hear a lot in the pregnancy and fertility world. The reason being is DHA is really, really good for our brain function. And it's also really important in the developing brain of a baby, okay? So that's why we always hear the buzzword DHA. Now, the recommendation for DHA in pregnancy is to get about 200 milligrams of DHA a day. Great. So a lot of us actually don't typically even get that in our diet. That being said, 200 milligrams is good, but could we do a little bit better? There's actually research to support that higher levels of DHA specifically in pregnant women not only allow them to keep their pregnancies for a longer amount of time, meaning there was less preterm birth and delivery, but also those births had better obstetrical outcomes altogether. Also, there's research to support that when mom is taking a fish oil during pregnancy, it's really, really good for babies' cognitive neurodevelopment and actually can help prevent behavioral disorders later down the road. So it's a really, really, really good thing to have on board. Now, where is fish oil from? Where are omega-3s from? They come from fish, typically. There's some vegan sources as well, but if we're really looking for a high potency product, we're typically looking at a fish oil. Now, the reason that quality matters so much in fish oil is for a few reasons. So first of all, fish swim around in the ocean, eat another fish, sucking in the water. There is an effect called bioaccumulation, which means that these fish can accumulate toxins and heavy metals within their body, okay? Especially this is really common in farmed fish, believe it or not. So when we're looking for a fish oil, or if you're even just looking to supplement nutritionally with fish as a meal a few times a week while you're trying to conceive or while you're pregnant, it's really good to look for a wild-caught source of fish. These are going to be the highest quality with the lowest level of contaminants. Also, this is a good rule of thumb. The bigger the fish, the more contaminants it's going to hold. So smaller fish like sardines and mackerel are going to have lower levels of heavy metals potentially than a larger fish like a swordfish, a shark, or tuna fish, for example. So those are all things to look for. Also, when you're looking for a fish oil product, when we look at fats, fatty acids, fat can go rancid really easy. So we want to make sure that what is on the label is actually ending up in your capsule and ending up in your body, okay? So this is the one thing where fish oils get a little bit tricky. It's really important to focus on something that is quality tested for purity and potency. That basically means that a company said to somebody else, hey, can you take this, test it, verify that everything that we have in it is accurate, okay? Now, if you're wondering about the safety of taking fish oil in pregnancy, I'm not your doctor, so you'll need to talk to your doctor about that specific topic. That being said, typically doctors do recommend at least 200 to 300 milligrams of DHA. Typically 600 milligrams is a sweet spot if you're really looking for a therapeutic dosage. So let's just go through a few kind of common things on the market, okay? I have 3 popular brands here that we can kind of talk about today. So for starters, a lot of people, there's a big gummy craze, like, right? No one likes to swallow capsules, so everybody's getting these cute little gummies, which I get. They're yummy, they taste good. Here's the problem. When we look at the back of the bottle, guys, we're only looking at 300 milligrams total of fish oil, and you're only getting 67 milligrams of DHA and only 13 milligrams of EPA. Keep in mind, guys, we're looking for at least 200 to 600 milligrams of DHA. Ideally, in my fertility clinic, I only want to see people on 600 milligrams of DHA or higher, both while trying to conceive and while they're pregnant. So in 2 of these little gummies, for example, there is not even enough for 1 day. And in addition to that, in these 2 gummies, you're getting over 3 grams of sugar. So if you take a few of these a day, you're really adding up, especially if you're somebody that has PCOS or struggling with blood sugar regulation issues. We want to be really careful of gummies because of the added sugar that they have. So for fish oil, it's not my favorite way to get it. Also, there are some concerns about the actual maintenance of the fish oil itself when it's in the gummy form. Is it being preserved and not allowed to oxidize? There's some kind of deliberation on that. So gummies are not my favorite thing. A really common thing is for people to want to buy a combination product, a prenatal vitamin that has DHA in it. I get it. It's convenient. And I think in a pinch, it really does a trick, especially because a lot of prenatals are going to have at least 200 milligrams of DHA in it. Again, we're hitting the minimums with that though. And in my opinion, we can do a bit better. And when we're looking at fertility, 1 capsule a day doesn't really seem like enough to build an entire human being when we're even just kind of thinking and looking at it like that. So combination products are not my favorite. In addition, in this combination product, we have nutrients and the fish oil together. And sometimes I worry about the way that the nutrients and the oil react together, right? Because we have water-soluble vitamins. We have fat-soluble vitamins. We have the fish oil, which is the fat itself. So about them all intermixing and the absorbability is another kind of concern. Again, good, but I think we can do better. My favorite thing that I always recommend to my patients in private practice is to focus on a separate product that's going to be just fish oil. This, for example, is Premom's prenatal fish oil. And the reason I like this one is because it gives you 660 milligrams of DHA, okay? And in addition to that, you're also getting 900 milligrams of EPA, right? So in total, we're looking at like 2.5 grams of fish oil and just 2 capsules, okay? So we're being really targeted. We're going right to the source and really giving your body, your brain, and your baby's brain everything that it needs. Also, fish oil is not just for women. Fish oil has been shown to actually help improve sperm quality parameters when taken. And that study was shown with sperm at using the dose of 1 gram of fish oil a day. So that's 1,000 milligrams of fish oil. So again, really important both for females and males to be working with their doctors to take a really quality fish oil vitamin. Also, this product is IFOS certified, it says on the label, and comes from a CGMP facility. So I know that they're using good practices to make it. I feel confident recommending this one to all of my patients. In addition, this product has just a little bit of vitamin D in it, 25 micrograms or 1,000 IU. Basically, that's just enough to make sure that our immune system is still doing what it needs to be doing without overshooting the moon and putting too much vitamin D on it. Also, vitamin D is fat soluble, so when we combine it with a fat like fish oil, it helps our body better absorb it. So that's just a few kind of important things for you guys to look for when you're looking for a fish oil. Really focus on that quality, purity, potency, and then also make sure you're getting a high enough dosage. Again, combination products and gummies are great and you're doing all the right things if you're already taking those. But if you really want to stack the deck, do the best things, for your baby and your fertility, going a little bit higher in concentration on the DHA specifically is an important consideration for you guys. So here's another thing that we can kind of talk about. There also were studies that done in women that took an additional fish oil omega-3 supplement actually had better pregnancy outcomes that women did not. This has really been studied. So that's why I'm a big fan of this. Let's talk about safety in fish oil. I get this question a lot. Is it safe to take while I'm trying to conceive? Is it safe while I'm pregnant? Now, again, it's really important that you talk to your doctor and make sure that this is going to be a good fit for you. When it comes to fish oil, okay, the one thing that we need to be aware of is it can thin your blood. This can be a good thing and this can be something to be aware of, okay? And to higher quantities, of course, we want to have concerns about thinning the blood too much. That being said, if any of you are kind of in the reproductive endocrinology world, maybe you're working with an IVF clinic, you may be taking baby aspirin already. And actually, there's some studies that have supported using fish oil in place of or in addition to a baby aspirin to prevent microthromboses, which can sometimes be the cause of miscarriage. So it's just one thing to kind of talk to your doctor and see if that's going to be a good fit and a safe choice for you. Typically, a very standard dose for fish oil is going to be 1 to 2 grams of fish oil, omega-3s a day. Specifically, around 600 milligrams of DHA is really something you want to look for. And that's just kind of a place to start and work through. And when we're talking about fish oil, the best time to start taking it is actually before you get pregnant. Not only have we seen studies where it can benefit fertility, right? So there's already a reason for it to be on board in both men and women. But also, that way, whenever you get pregnant, you know that you have that DHA around. You have the building blocks for the second those first neurons start to form. We have the fatty acid support that's going to be in those cell membranes, help making up the nervous system, all that stuff. So it's a really important thing to have on board through both fertility and then while you are pregnant. In addition, we find that omega-3s are also transferred via breast milk to our babies. Also, you've probably seen in baby formulas, they have DHA added into it. This is another reason why when you take a fish oil while you are trying to conceive, while you're pregnant, and while you're lactating, all has really, really, really good benefits for not only you, your mood, your body, your memory, your inflammation, but also your baby's neurodevelopment. It also helps the development of their retinas. So really, really, really important across the board in all phases of life for women, but especially these childbearing years in women. As you can see, fish oil is so important when it comes to TTC and also during pregnancy, in lactation, and for all of life and your partner and sperm quality in general. It's such an important component, but there are a lot of things out there, right? So here we are. That's why you're here on the Premom channel. We're breaking things down, bringing you the best fertility resources that we're able. Also check out Premom.com. We have some great blogs when it comes to really dissecting fish oil. If you want to dig more in depth, there's some great content there. Keep a lookout for more prenatal videos from Premom, and comment below if you have any questions, comments, or let us know what you like and what fish oil you take.